Very good morning, friends. I'm Dr. Sandeep Sonawane. I'm consultant joint replacement arthroscopic sports surgeon practicing from Andheri to Kandivali. I have my own joint replacement and arthroscopic center, Quadratic Joints and Spine Clinic, located at Kandivali. I was being intensively trained as a fellow in USA and Singapore for joint replacement arthroscopy and the sports medicine surgeries. I'm here to talk to you about the osteoarthritis today on the occasion of Osteoarthritis Day. So let's try to understand what is basically osteoarthritis. Osteoarthritis can happen with any joint. It can happen with the knee joint, hip joint and shoulder joint, but it is most commonly seen in knee joint and the hip joint. So let's try to understand osteoarthritis on a model. So let's talk about the osteoarthritis of the knee joint. First of all, let me tell you the knee joint is formed by the thigh bone, leg bone, and that joint has a smooth surface called as a cartilage. This is the surface which gets worn out with the age or like many other conditions, trauma, or like in females it is most commonly seen because the diabetes, hypothyroidism and all other medical problems are more commonly seen in the females. So all these problems contribute to the osteoarthritis in knee joint. So you can see there is a smooth surface at the beginning. With the age or with these medical problems, it will get worn out, roughened up, and at the end you can see the very rough surface of this joint, which gives you a lot of friction and the pain. God has given capsule to this joint as well, and the oil inside is called as a synovial fluid, which gives you lubrication. But like with the age, that oil also gets turbid and dirty. So to avoid the knee replacement surgery at the end, what we can do? So to cut down on the osteoarthritis of knee joint, we need to take some precautions. So first of all, we need to do some hot or cold compresses to your knee joint so that your knee joint will be healthy. Avoid too much of bending or putting up a lot of pressure, like day-to-day activities, sitting cross-legged on the floor, using Indian toilet, or taking long flight of stairs where there will be a lot of pressure on the knee joint. And third thing is physiotherapy exercises which are going to strengthen the muscles all around knee joint so that your knee joint friction will go down. Last in the list will be the medicines and the knee replacement surgery. So to have a good health on this osteoarthritis day of your knee joint, I will recommend you to have ice or hot fermentation, lifestyle modification and the physiotherapy exercises. Thank you very much. I appreciate you for your time.